heart specialists are among the first in the nation enrolling patients in a breakthrough trial to help save lives.
Medical reporter Liz Bonis got an inside look at how it is giving patients new options and new hope.
Got great stuff to share here. The trial is open to those who've been told that they may have no other options for treatment of certain heart problems except very invasive or life-altering procedures such as a heart transplant. Today we introduce you to the team at the Christ Hospital conducting the trial and Charles G. Jones, the first patient in the state of Ohio to receive breakthrough technology as a participant in it. After years of struggling with heart complications,
I almost passed out at a Bible study. They could never get my heart rate up.
Dr. Dean Kereiakes and Dr. Satya Shreenivas say Charles was the perfect candidate for what's called the AccuCinch. It's being tested as part of a national trial, and as this animation, courtesy of Anchora Heart, shows, the technology is inserted through a tiny tube called a catheter, so that these anchors can then be placed around the base of the heart. It is attached to a cable.
And then you can cinch this cable, hence the name AccuCinch. And when you cinch the cable, it decreases the size of the heart muscle. It's basically like a belt around the base of the heart to support the heart muscle. So it doesn't have to work as hard. And if it doesn't have to work as hard, hopefully, and this is the hope, it can start recovering, it can start healing.
Do you make it tighter than you need to in case it relaxes?
I think initially we do that to some extent. When this settles, by the next day you can see little gaps that we didn't really appreciate before.
In Charles's heart, as they showed me, it does appear to be doing what it is supposed to do. In his case, assist with a rhythm and valve disturbance, which had enlarged his heart.
And we saw an immediate, right after the procedure, shrinking of his heart. This belt really worked. We call it a belt, kind of like Spanx on the heart, so to speak, but it tucks the ventricle. And when it does that, the valve that's leaking because it's being pulled apart either quits leaking or reduces the amount of leak, which helps him as well.
Charles is one of about 15 so far enrolled in this nationwide trial.
I've been doing very well. I really have.
The hope is that others too will show similar remarkable success.
Well, the benefit continues to get better and better. The heart remodels itself, and this is the thing that is truly revolutionary.
Now, this trial is still open for enrollment. We have a link to the team at the Christ Hospital Heart and Vascular Center if you want to reach out to them. We also want to invite you to hear more about this and other breakthroughs at our next free heart-to-heart seminar. It's Thursday, November 21st. Mark your calendar. Details are on the homepage at local12.com, or you can RSVP by calling 513-841-4671. We'll throw it back to you.